Hello and welcome. Today's topic is our development of the respiratory system. Try to understand at the 4th week of intrauterine life, laryngotracheal groove arises from the hypobronchial eminence of the floor of the pharynx. Okay. So what is pharynx? You already know. What is hypobronchial eminence? You already know. Now this laryngotracheal groove extends to form laryngotracheal tube. Okay. Now this laryngotracheal tube is also known as laryngotracheal diverticulum. Now lung buds appears from the one part of the laryngotracheal tube and the rest of the part it further elongates. Okay. Now in further elongation what happens? At the proximal part it forms the larynx and the distal part it forms the trachea. Okay. Now fate of the larynx. Okay. See, larynx is a connector in between the laryngotracheal tube and the pharynx. So the adjacent mesenchyme of the 4th and 6th pharyngeal arch, it covers the larynx and converts into T-shaped orifice. Now the surrounding endoderm blocks this orifice, but later it recanalized within few days. During recanalization, that endoderm forms two pairs of proximal vestibular fold and distal vocal folds. Now the distal vocal cord converts into true vocal cord and the proximal vestibular folds convert into false vocal cord. Okay. So what is vocal cord? I talked about these things in my anatomy videos. You can check those. Now the gap area in between this vestibular fold and the vocal fold ultimately forms the ventricle of larynx. So what is ventricle of larynx? You already know about in anatomy videos. Okay. All the cartilages of larynx are formed by the mesenchyme of the 4th and 6th pharyngeal arch except epiglottis cartilage. Actually it appears from the hypobronchial eminence and all the muscles of the larynx develops from the 6th pharyngeal arch. So this is the overall development of the fate of the larynx. Now the fate of the trachea. What happens? From the distal part of the laryngotracheal tube it gives the tracheoesophageal folds. Now what is tracheoesophageal fold? I already talked about these things in my how the GI tract develops. Okay. From that ventral part of this tracheoesophageal fold it forms the trachea and the dorsal part it forms the esophagus. Okay. Now this trachea continues to elongate and divides itself into right principal bronchi and left principal bronchi. All the details of this larynx and trachea I talked about in my anatomy videos. You can check those. And now the development of the lungs. As I said, the lung buds appears from the one part of the laryngotracheal tube. Anyway, these lung buds grows inferolaterally, I mean downward and laterally, and expands or bulges into pleuroperitoneal canals. This canal gets ultimately filled or occupied with the growing bronchial tree and lung parenchyma. Gradually, this surrounding splanchnic mesoderm forms the connective tissues. Pleuroperitoneal canal converts into pleural cavity later. Now, the left principal bronchus divides into upper and lower bronchi, and the right one divides into superior, middle, and lower bronchi because the right lung has 3 lobes and the left lung has 2 lobes. Okay. After formation of these secondary bronchioles, within few months, these bronchioles again gives multiple branches. Okay, from one branch to another, from there to another, from there to another, from there to another, from there to another. So like this, one after one after one, ultimately up to 7 months, we are getting the 17th generation of the bronchioles. And after birth to within 3 to 8 years of life, we get extra additional 6 to 7 generations of bronchioles. Ultimately, we are getting almost 21 to 22 generations of bronchioles in our lung, okay, or adult lung. Now try to understand the maturation process of the lung. 6th to 16th week of life, what happens? Pseudoglandular period. Now in this period, our respiratory bronchioles and the alveoli forms. 16th to 26th week of life, what happens? It is known as canalicular period, where the type 1 and type 2 alveolar cells develops. From the 26th week to up to the birth, terminal sac period. In this period, surfactant produces and the blood air barrier it thins out. Okay. After birth to the 8 years of the life, it is known as alveolar period. In this period, our lungs get ultimately grown and fully developed and perfectly functional, and it forms the adult lung. Okay, so this is the maturation process of the lung. Anyway, this is the overall development of the respiratory system. I hope you will understand, and see you in my next video. Till then, bye.